right?
Yeah,
she's a nurse.
Yeah, she apologized. She worked a 12-hour shift last night at the hospital, so she couldn't make it out this morning. But she's very grateful that everybody's willing to support us, and especially the work that you and Deb have done to make this happen. I mean, it's really the only thing that's keeping us going is people that are willing to dedicate themselves to helping us out. Jamie and I we try to organize events, but we're usually overwhelmed just by administrative and communications and marketing. That's primarily what we do with all the donations that we collect. We advertise in all the biggest medical journals that we think are relevant to this disease. The two biggest journals are New England Journal of Medicine and JAMA, which is a journal of the American Medical Association, and those both go out to roughly 300,000, mostly people in the medical community, doctors, nurses, every issue. So we hit that, both of those, probably 2 or 3 times a year, and we also market ourselves in specialty medical journals that are geared more towards pediatrics, and we just started doing stuff that's advertises towards OB/GYN and labor and delivery. Because what we're basically trying to do is we're trying to educate the front line of medical staff that would have a chance to diagnose a child that suffers from Menkes. We've diagnosed, because of our ads, we've diagnosed children who have this disease as far away as Guam. So we're getting out there, we're making a difference. We've had medical students contact us wanting to write their thesis in college about this disease. So we're too small right now to raise money and fund some multi-million-dollar research project. But we know we can make a difference by advertising, because we can spark interest with doctors and physicians, nurses, get them interested in this disease, researching this disease, diagnosing this disease. And unfortunately, there's not a cure right now for the disease, but we are able to make a huge difference in the quality of life for anybody that suffers from this disease. Our son Wesley, who passed away in 2006, was put through a lot of unnecessary testing, and it probably took approximately 4 to 5 months to know what was wrong with him. We thought he had some kind of virus or something that caused brain damage. He was causing him to have seizures. So he was put through a lot of very painful medical tests, spinal taps, you name it. He probably had 100 different doctors take a look at him before we were able to diagnose this. We were at hospitals in Florida, we were at Hopkins, and he was eventually diagnosed at DC Children's Hospital, where a genetic genetic doctor who was doing his fellowship was there, and he took one look at him. Because he had experience or prior knowledge of this disease, he took one look at him and diagnosed him. He was 99% sure that's what it was. And one of the ways they diagnose them is their hair is very brittle and coarse, and they have pale skin and poor muscle tone. Those are just a few of the things that we put on these advertisements. So when a physician gets this ad or this resource, they can use it as a tool. They can tear this page out and use it as a tool, so if they ever do come across a child like that, they'll be able to diagnose it. So we've only been around for a few years now, probably because of parents of other children who suffer from this disease, who have supported us and had major fundraising events that they've organized. We probably raised about $100,000 in the last couple of years. Probably 90% of that went towards advertising in the journals. Some of it went towards helping children who currently suffer from the disease. It's not our primary focus to provide medical equipment or support, but there has been a couple of instances where we've come across a family that's been in a really hard situation that we've helped them out with financial assistance. don't know if is there any questions that anybody would like to ask? I just want to thank you guys for being here and doing this. This means a lot to Jamie and I. We're very excited about it. Very excited about everybody seeing our son and our website across the eastern half of the United States. So I'll be leaving out something. So if there's anything that you guys want to ask,
well, the statement that I would make if I were you, Drew, is Lance, don't screw up.
Really? Don't get a lot of speeding tickets.
That's right. No speeding tickets. All of the speed, all the things you're supposed to do. But thank you very much, Drew.
You get 10 miles over.
Appreciate it. Yeah, exactly. Thank you very much.
If anybody wants to look at these ads, these are the two big journals. I talked about JAMA and the New England Journal of Medicine. You can look at these. That has a picture of our son Wesley, which is the same picture that's up here. And then what we usually do is we usually have one picture of our son, and we cycle the other two pictures out with other children that we've come across. And we've probably been in contact with, I'd say, at least 100 different families so far.
And I go on the website. There's a link that says